Dave and I had infertility, and we were infertility specialists and didn't realize that we were going to have a problem. And after a couple of years of trying some of the tricks that we have up our sleeve, we weren't successful. So we decided we wanted to go and adopt somewhere.
He mentioned to me that he had become involved in Haiti and showed me some pictures and the things that he was interested in accomplishing there. I in turn told him that we were interested in adopting.
And the night before the trip, my husband and I both said, this is a mistake, we shouldn't go, but packed up our bags and went anyway.
We fell in love with the place about 24 hours after we were there because by that time we had met a lot of other committed individuals, we had met a lot of orphans, we had met a lot of really nice and good people.
When people go to developing countries, they think that they need to go in and save somebody, and that wasn't really what we were thinking. We went in and got to know the community and the people, and then we asked the community leaders, okay, what do you need?
The overall opinion of the folks at Family Health Ministries, including us, was that we needed a new hospital there. We had begun to construct a clinic on that site, what we call phase 1 of the project. We were up pretty much that entire night. The next day we were nervous wrecks all day, not knowing who had survived, who had not survived, what was destroyed, what wasn't destroyed. Both of my daughters still have family in Haiti. A lot of the work that we had done or had planned to do went down with the quake. So the orphanage, for instance, was completely destroyed. We, about a week later, had some sense of what was going on there and started to make plans, and we knew that only one of us could go to provide immediate relief, and Elizabeth was the one that went down there.
Initially, they didn't have anywhere for us to sleep, so we were just kind of sleeping on the roof. Some people chose to sleep inside of the building, of the clinic, but I had seen a lot of the pictures, and many of the buildings, when they fell, they pancaked down. And so I figured if another earthquake were going to come, I was going to be on the top level, so I would have a chance to walk off.
Every morning at 4 o'clock, people would start to congregate, and they would form a line. And then they got triaged about 5 or 5:30 by some of the volunteers. But we had people walking for 10, 15 miles in order to come to the clinic, simply because it was the only medical care that they had access to. And we would see somewhere in the vicinity of 250 to 350 patients a day among the 4 physicians that we had. We kept thinking, gee, if we had had another year delay, they would have been there. They could have been in the school that collapsed. They could have been in the orphanage when it cracked and came down. The people of Haiti are a wonderful group of people who love life, and they love each other, and they are in a fairly desperate situation, but don't look at it as a desperate situation that's hopeless. And I think what they would like from us is any help that we can provide them to let them do what they need to do to rise above the terrible situation that they're in.
But yeah, we'll keep going. Dave's going again in October. We'll just keep going.